Well, welcome everyone. Thank you so much for being with us today in another one of our Frontline Conversations with people who are really dealing with the COVID-19 situation. And I got to say, I've always felt that in an emergency, in a crisis, people look to their local government probably first for help. I mean, it's the government closest to the people. It's the police, it's the fire, it's the schools, it's health. And we're delighted to have County Executive Angela Alsobrooks with us today from Prince George's County, who had a wonderful year planned for herself and her county until this COVID situation arose. So I just want to say, Angela, thank you very much for being with us. Madam Executive, it's always great to see you, to talk with you. And let me just start with, how are you doing personally? How's it going?
Can you hear me there?
Yes.
Okay, that's better. Yeah, you know what? I'm doing well. I have no complaints. I'm well and feel very blessed to be well. And my parents who are older and who live in the county are well. And for those of us who have aging parents, it was a big concern, you know, and my daughter's well. So I'm doing well and working hard, but you know, it's very fortunate to be able to have parents who are doing okay.
And how are you sleeping? Are you getting enough sleep? I always got that question wrong. Are you getting enough sleep?
Well, you know what the strangest thing is? I am working the same amount or more hours, but I find that, believe it or not, I've learned that there's some benefit to taking out the transit. And so it's given back, believe it or not, a little time that I didn't realize I was losing so much in transit. So that I've found that I've been able to be very productive, and I've actually been able to sleep a little longer. I was waking up at 5 o'clock every morning to help my daughter get ready and get to school. But now that she's doing the distance learning, it's meant that, you know, we are spending less time on the road and more time together. And I'm actually even able to get a little bit more work done without driving all over the place. So I find that that's a kind of a nugget from this.
So you're working from home. So what's a typical day like for you?
Well, you know, I get up every morning and we start with an executive briefing. And I have, there are about 12 or 14 individuals who we hear from every single morning. I start that very early in the morning, at the latest by 8 o'clock. And I hear from our fire chief and police chief and everyone. And we just kind of begin with the health officer. And then throughout the day, there are a number of those same kinds of conversations that are happening. We started basically a dashboard to give me some idea every day about hospital surge. I want to know every day how close we are to bed capacity. I want to hear every single day how we're doing with those ICU units. I want to hear every single day how we're doing in our correctional facility and what's happening with the meals programs that we've rolled out. And so every day I have a number of those conversations. And we've also established a group that's helping us to manage some of the funding associated with this crisis from the federal government, a whole team of individuals who are just monitoring the expenses associated with it. And so we do those are routine, but add to it, for example, tonight, I have a call every Monday night at 7 p.m. with all the elected officials throughout the county. There are about 120 that join me every Monday night at 7 p.m. And I do a briefing for them every Monday. And I have a number of those kinds of calls that I do with various constituencies throughout every single week that we do with our municipal officials. I do that with the faith community. So it is call after call after call. And I talk to the county executive. There's 7 of us that meet by phone every day. We're doing it at 2 o'clock. So I've already had that call for today. And you know, it's just that's how it's going. But the collaboration has been amazing. It really has been. We've worked very closely together.
So the 7 county executives, those are the ones in Maryland?
Yes. So
yes.
Montgomery County, yes. Mm-hmm.
That group used to be called the Big 7. It probably still is. But
yeah, okay, that's
it. More when I was there and Dutch Ruppersberg was there. But,
that's it. The Big
that's a
7
great group. That's a great group. So.
It is. We talk every day.
So tell me about your staff. How's your staff doing? Does anybody come to see you at home? Does anybody? How do you interact with your the CAO and the other professionals in your staff?
You know what, so we do mostly remotely, and we decided pretty early on, especially as the virus started really kind of unfolding, that it was safer for us to maintain distance even from each other. So I see them, you know, a couple of times a week. We do press briefings and other things. We have to see each other in person, but for the most part, we've decided to try to keep ourselves healthy so that we can continue this work. And so I do a lot of this we do Zoom calls and we are talking to each other. But let me tell you also, one of the real you know, the blessings of this has been the team that we have. We have a very experienced team. You know, Major Riddick. Many on this call will know Major Riddick, who worked with 5 different county executives. So how lucky to have a person with his experience working with me now as my chief administrative officer. And the rest of the team, they're a very experienced team. So, and this is a time where it's mattered.
So about the first responders, you'd mentioned some of that a little while ago. How are they doing? How are the police officers doing? The firefighters doing? The people who are responding to these calls for help? And are they, you know, how are they handling this?
Well, you know what? And I think over time we'll find out how they're doing. To be honest with you, I've understood from hearing from them that we think this is going to cause some residual devastation for our first line responders who are right now in crisis mode. So they're responding and they're doing an exceptional job. But I think we expect that there will be some mental health toll that happens for those who've had to see so much illness and death and to have been able to respond in the way that they have. So we're going to have to keep an eye on all of our first responders, because this has been a circumstance that no matter how experienced, no one has ever seen before. So I'm hearing from them that it's tough. It is really tough, but they have done an amazing job. Our fire chief and our public safety director, Mark McGaw, has been with us probably 30 years. He was our chief of police. And one of the things that he's done is to work to make sure that we've cross-trained, believe it or not, all of public safety, so that we thought that if there was a circumstance where we would run short on EMT because they became sick, we have now cross-trained police officers and sheriffs to be able to drive ambulances. So they have just done an amazing job in preparing as correctional officers. So they are now cross-training in a number of areas to make sure that we don't miss a beat in terms of being able to respond.
So have any of your county employees gotten COVID or any sick? Have any died?
Well, you know what? We've had some who've been sick, some who've been very, very sick. I just learned today that one died. Just today, I learned right before I got on this call that we just lost someone in our health department to COVID this afternoon. We had another one of our executive leaders who actually was very, very ill for some weeks and is still recovering from COVID. And I had some very close staff members who have lost parents to COVID. And I have had, I mean, it's just been, I could have never imagined dealing with this level of devastation. That was in the first few weeks. My chief of staff's father died of COVID-19. And I mean, it's just, it's just been horrible.
We're very sorry to hear that. It is a horrible situation for everyone.
It is a horrible situation.
And the people who are out there, I mean, people working from home, but there are people who can't do that. And like the police officers and the firefighters who have to show up for work, have to be with others, have to respond to scenes where the illness is, must be, it's a very tough time for them, as you said. So our thoughts and our prayers are with them as they go through this. How about the rest?
Remarkable. I just want to say, well, they're remarkable people. I've heard from some of the frontline workers that their perspective is slightly different than you expect. One, for example, who works in the ICU, who said she feels closest and feels she's in her calling. And this is a time where she feels a special kind of peace in terms of doing exactly what she feels she was trained and called to do. And so caring for sick people in this way gives her some measure of peace, almost, to be there rather than sitting at home. She's actually helping.
That's
so they're special. They're special human beings.
Absolutely. That's a great story. Thank you for sharing that. How about your relations with the governor? We talked about the other county executive. We talked about a little bit, Hogg and the governor. One thing I've noticed is every time when I was in office and we had a crisis, the federal government was there immediately. How can we help? And this time it's almost like, well, you're kind of on your own and you're, we'll talk a lot, but we're not going to do much. It's very frustrating to me as a former local official to see that when the standard had been everybody jumps in, everybody says we can help. So you're having to deal a lot with the governor now on things, and Laura Hospital, other things. Talk to us a little bit about that.
So the governor has been just great to work with. He has been extremely accessible. I've been on calls with him each week. We talk to his staff throughout the week. We'll have a call with him again tomorrow because he's had to step in, as you mentioned, because we found that we were not getting what we needed quickly enough from the federal government. So, for example, regarding personal protective equipment, the test kits, all of the things that we need for our frontline workers. We've been waiting and waiting and waiting. You see that the governor felt that he needed, because of the slow response, to go and on his own secure 500,000 test kits to bring them back to Maryland. This should never have to happen, but it did. And so I really do thank him. His leadership has been outstanding. He's been, like I said, very accessible and hearing from us. And, and we're working as best we can. This is a circumstance, again, that none of us have ever seen before. And so there are adjustments that have to be made all along the way. But at least there is an administration that's willing, I think, to work with us, to hear from us. And so we're, doing our best to get it right every day. And we're still, from my estimation, very much in the thick of this thing. It's not over yet. And that's the, and that's the challenge of it, is that I cannot see yet the end. We're still very much in the middle of it, with rising hospitalizations and, rising positive cases, and still don't have all of the equipment we need. We're still working to get the test kits we need and the contact tracers that we need. And so we are still very much in the thick of this. It is far from over.
Now, in terms of hospital beds, you're working to reopen a hospital. With the state, can you talk to us a little bit about that?
Yes. So in Laurel, Maryland, we reopened a hospital there, reopened it with 135 beds. Believe it or not, we're already pretty much at capacity. We just opened that hospital a couple of weeks ago with additional beds. And so we opened that one. We also stood up a testing and screening site, first at the FedEx field, but that was really difficult because of the elements. It was outside. But with the help of the state and the National Guard, we stood up a testing site, but the wind and the rain and those elements drove us inside. So we're now under a covered area in Cheverly, where we're continuing to do that work, and we're opening up 2 additional facilities in the northern and southern part of the county. But we've had to have ICU pods, trucks that come now with the ICU units because of the good number of sick people. The people who become sick with COVID in Prince Georgian become very sick with COVID. So what we're seeing is not the usual med-surg beds, but that our folks need the ICU, the ventilators. They become, we have a good number of very critically ill patients. So we've had to expand capacity and put pods outside of hospitals, and tents outside of hospitals to try to accommodate the sick folks. And our hospitals are running probably at least 70% capacity right now. So this is a real concern for us. You're hearing all around the country, people are anxious to open up. The question is, if we're operating at 70% capacity right now in our hospitals, if we open up prematurely, we don't know what situation we may be in, because we expect that the cases will rise. So we have to be very careful about how we approach a reopening.
And Governor Hogan's is very careful of that as well. And he's taking things very slowly. He's trying to listen to the science and his advisors on that. You have Prince George's County has the highest number of COVID cases in the state. Montgomery County is right behind you. Is that number plateauing? Is it still going up? Is it, where do you see that? Where's the projection of when you might hit a peak?
Well, at the moment it's still going up. That's the case still for Montgomery County as well. It is because we're in this capital region area. Our proximity to the district and to Montgomery County and Northern Virginia. What you'll notice, Doug, is if you notice Prince George's cases are still going up, we're seeing the same in the district. And you just heard today that Northern Virginia is also having the same challenge. And it is because our borders are so contiguous that we're seeing a good amount of movement. Prince George's has a large number of essential workers who go out to work each day to make sure people can still eat and that essential functions are still moving. And so we are, and again, our geographic location means it's really a challenge for us. So our numbers have not flattened. We have not seen a flattening yet. We're over 9,000 positive cases and close to 400 deaths. So our numbers are not flattening. They are still rising, and we're working to get them down, reminding people to stay home, that this is not done yet. And they're really adhering to that. Our residents have really been very cooperative in terms of staying at home and making sure they're out for essential business. So but it's just, it's not flattened yet.
So what's going to ask you about that? So in my experience, every time you have a crisis, there's always a point where the people turn on you, whether it's a snowstorm and you haven't gotten to their street yet. There's some point where they say, enough's enough, I'm sick of this, forget it. And we're seeing that in other parts of the country. You really have not seen much of that around here.
Mhm.
And I was just going to ask you about that. Are you seeing any of that in Prince George's? We had a restaurant in Colorado that opened up for Mother's Day and had hundreds of people in the restaurant. No masks, no social distancing. It's basically they're a new hotspot for the virus. So I think
Yeah.
we're lucky we haven't seen that yet around here.
No, you know what? And so I'm a little biased. So let me just start there because this is my hometown. I think Prince Georgians are the salt of the earth, right? So, so I'm not surprised. They have just been beautiful. They have not turned on me yet. But you know what? They are anxious to get outside. I understand that. You look at the economy. People do want to work. They want to open up their businesses again. I can understand that people are feeling anxious to get outside, but the messaging that I'm getting is people have been super responsible about this. I got a number of messages over the weekend after hearing that I am not anxious to move us too quickly. They said, you know what, we're with you on that. That people don't want to be sent out there to get sick and to die. And again, the people we're talking about who are getting sick and dying are people we love. So I appreciate that people have been patient. But the other key to it is this. As long as you provide for the needs as best you can, I think that people will remain patient. So we have put in place a rental assistance program. We put in place as many of the food, kind of the capital food bank, and we've had the World Central Kitchen. The county has also put up a certain amount of money. Nations Bank, Bank of America rather, gave us $500,000. So we have tried to make sure where we could that we're also caring for the needs of our residents. Aside from the health care impact, we're also just making sure that we're communicating as seamlessly as we can. Also, we gave $200 gift cards per week for residents who were earning $19 or less per hour. So just as much assistance as we can, I think will help, hopefully, to take care of people while they're waiting.
And people I've been talking with really have said, even when they say it's okay to open up again, they're not sure they're going to go out. Businesses are even saying this. I'm not sure I'm going to open when they say it's time to open. I'm going to wait a little bit just to make sure we're okay. So there is a lot of understandable fear out there, as there should be. And I've been very proud of not just Prince George's, but the entire region, because again, we have been listening to our elected officials. They've been giving us good advice. They've been very honest. You particularly been very honest with all of us and said, here's what we know. Governor Hogan's been very honest. I think once, when you're transparent like that, I think it makes it easier for people to pay attention and follow what they're being asked to do. So congratulations.
Yeah. I think it's a matter of trust. It is. And it's the most important thing you ever have is for people to know that your motivations are clear and clean, that I only care about the life, saving the lives of the people who are here, and their livelihood is important to me too. But this is a point where we're trying to save lives. And I think people get that. We don't take it lightly.
You're absolutely right. It is a matter of trust. I think that's the most important thing any elected official can have with their constituents is trust back and forth. That they'll let you do things if they trust you, that you're going to do them for the right reason, and they'll pay attention to what you're asking them to do. So again, I want to congratulate you on that. You have seen a great level of trust with the people of Prince George's. Talk about now the region, COG, Council of Governments, Northern Virginia. I mean, yes, Montgomery and Prince George's are part of Maryland, but I think in terms of this COVID situation, we're really more a part of the Washington, D.C. greater region.
Yes. So
can you talk about how you're working with fellow regional leaders and what that's like?
Yeah, so that's been amazing as well. As we've been working with COG, also been working with the district. Mayor Bowser and her team have also been communicating with us seamlessly about what we're seeing on either side, because we can't do this alone. And part of what I was excited about and also disappointed about is that we were working together so well before COVID came. And as you probably recall, there was even some cooperation in terms of how we would pursue economic development opportunities together as a region. And there was so much excitement about that. And then this happened. So we had already, before COVID, developed the kind of relationships through COG where we were seeing ourselves not just as individual jurisdictions, but as a strong region. And that we, basically all boats rise at the same time. We realize that our destinies are tied to each other in really amazing ways. And so we had that recognition and had the relationship prior to COVID, and it's continued. And now that we're going to recover together as well.
Since you mentioned economic development, let me shift to that just for 1 second, because I thought since your election that Prince George's County had a real opportunity to move forward in a dramatic way in terms of economic development, in terms of number of jobs. in the county. You have been growing jobs at a very good rate, particularly compared to Montgomery County. I think there were some issues with Montgomery County's business environment. And now this has come and sort of put a halt to an awful lot. But the hospital that you're building, is that still under construction? Is that still going on?
It's still going. Yeah, so it's still going. 2 points I want to make is you're right. When I talk about where we were, Doug, you realize that before this happened, we were leading the state for the last 5 years in job growth, and we wiped out all the jobs we created in less than a month. That's what COVID did, but we're still constructing the hospital that's scheduled to be open April of 2021. Again, COVID struck us a year too soon. We were building our hospital infrastructure through our new hospital and new hospital partnerships here. And had this happened next year, we would have had a little more capacity, but we're working through it. But our hospital will still open April of 2021. So we're excited.
And it's not just a new hospital opening, it really changes having that University of Maryland medical system hospital there, I think changes your whole healthcare system in the county. I mean, it's a remarkable improvement from what you had before this hospital would have opened. And you're right, it's a year early. You would have been much better prepared next year to handle this because of that hospital, everything that the University of Maryland brings with it.
So we were transitioning. There were a number of disparities. Some of it was in the healthcare delivery system, in that most Prince Georgians, about 60% of them were going outside of Prince George's County for their health care. You look at the southern part of our county where we did not have adequate bed space, and those are the things that are coming back to hurt us now. We have been applying for a certificate of need to expand bed space in the southern part of our county where we have an older and growing population, and we were denied that certificate. So we have a hospital there that just does not have the capacity we needed, but we were transitioning. So the Capital Region Medical Center, we have Adventist who bought out the hospital in the southern part. We have Luminous Healthcare, MedStar. So we have this growing kind of network of care, and this happens. But you know what? We're still going to build it. Those relationships are being cemented, but the same is true for economic development. We had food deserts here. 55% of all of our eating, all of the dining here is fast food. You can't, and so these underlying health conditions, the COVID attacks, the diabetes, the lung disease, all of those underlying chronic health conditions, we had a disproportionate share of them because we had this weak hospital infrastructure and the delivery of healthcare here wasn't as strong as it should be. We had whole areas, again, with the lack of healthy foods. And so those were things that we were working on. And now, even more than ever, we are so determined that when this storm passes, we're going to continue, get right back on that trajectory, get our hospitals open. We had a number of businesses who were interested in coming here. And the good news is the underlying conditions that attracted those businesses to us, the transportation systems, the road systems, the proximity to the University of Maryland College Park, all of those conditions are unchanged. So we still remain an attractive location for businesses to come. But we hope, and I'm just going to say it, when this is all done and we finish, we're now investing in businesses, right? So we're making certain investments to help them recover. And once they recover, we hope that they will remember to help us as well. All of the businesses that we have supported to help get back on their feet, we expect them to come here, to bring their healthy foods here so that our residents can eat healthy foods and not have to travel outside of Prince George's County to do so.
How about one of the major economic development successes in Prince George, the MGM grant? How are they doing? What's the prognosis for that? And what are they looking at in terms of any kind of reopening or anything?
It's been devastating. You know what? I mean, it's like Las Vegas, where they closed. I mean, it's been devastating. MGM is the top taxpayer in Prince George's County, is the #1 taxpayer. And so it not only impacted the revenues in Prince George's County, but it also was huge for the state. We have this education trust fund that is funded by the 6 casinos in the state of Maryland. And so that education trust fund that really benefited from MGM and the rest of these casinos will see a revenue shortfall there because of the casinos closing. They will reopen eventually. We don't know what that will look like for them to reopen, but we're confident that, all of our businesses eventually will find a way to safely reopen. But in the interim, it has really caused, a disruption economically for us.
Some people have asked me, aren't you glad you're not in office anymore? And actually, my first response is no, because when you have a crisis, there's something that's just very invigorating about it. You get a lot, you brainstorm a lot, you get very creative, very innovative, you get to do some things. And then I stop and say, well, yeah, that's okay, but the one thing I don't want to deal with is the budget resulting from the crisis. So you got MGM Grand, which is devastating, and a big taxpayer to you. How's the budget looking for next year, and what kind of hole are you seeing there? It's got to be very worrisome.
Yeah, it's a pretty big hole that we're going to have to fill. We're looking probably at about $60 million short this year. Probably at least another 120, 30, $40 million next year, I'm hearing. But we're preparing for it. And you know what, the thing about Prince George's is we have had to do more with less. And you know what, that's a weird way of looking at it. But we have had to protect our bond rating. We have that AAA bond rating. We have been very conservative in terms of our fiscal policies to make sure that we keep a reserve and that we're making really wise choices. And we're going to, just hold the line. We have already decided, of course, the cost of living increases, and we have frozen hiring. So we've already made some decisions to help us to recover. And we absolutely will be able to recover. Again, we're going to be in a bit of a tough situation for a while. But we are really keenly focused, first of all, on making sure that we are protecting the county's credit. And we're making choices also, hopefully not to have to lay off or furlough anyone. So that's also been a priority. We've been meeting with our bargaining units. They have been very supportive and understanding. We've made sure we've stayed in contact with all of the unions. And they have understood that they likewise have to make some compromises to make sure we keep people working. But we'll make it through this.
So talk to me a little about schools. I know you're in constant contact with Monica Golton. She's going to be one of our guests on a conversation like this in the future. How's that going? And I know they just announced that schools are closed for the rest of this academic year.
Yes.
Are they looking to reopen in September? How is the school system holding up?
You know what? So again, when I tell you about all these experienced people I have, you mentioned Monica Golson, who's been in the system in Prince George's for 27 years. So she's a person who not only graduated from our school system, but started there and has been there for 27 years. So she has just been amazing. The parents love her. They trust her. All of the folks who work in the school system also follow her very easily. And she's been a respected voice on the state level as well. So she has listened well, provided all of those. Not only have we provided the distance learning, and we did that as best we could. There were some challenges because 60% of our students are on free and reduced lunch, 62%. So when you start talking about distance learning, there are a good number of kids who would not have had the technology to do so. So she first had to secure enough technology for them to be able to do the distance learning. We've also had to stand up nearly 50 food stations throughout the county for our kids who rely on those meals to come and to get the meals, to have breakfast, lunch, and dinner. We just recently announced we're having a virtual graduation ceremony on May 30th. With Taraji Henson, who graduated from our public schools in Prince George's County. So she's, I think, done as best we could. Now, one of the things we're working on now that I'm very concerned about, and Dr. Golson is as well, as you can imagine, we're concerned about the achievement gap. What happens for students who are already struggling in some ways when you're not in school for 6 months and you may not have, because your parents are essential workers, the ability to have a parent sitting at the computer with you? What happens to the achievement gap over the summer? So we're working now to hopefully put in place free summer school to be able to attend to the needs of our children. We're working also with some private entities that we want to have come in and offer chemistry and algebra for some of our students who are on that trajectory to get to college and take the AP exams and to take the SAT exams. So we want to make sure that our kids are not at a disadvantage when this is done, because one of the unintended consequences, I think, of this will be if we don't pay attention to that achievement gap, it will grow exponentially right now for the children who we educate. So Dr. Golson and I have been working on that.
I love this conversation. You are an executive after my own heart. I always said that you can tell who is a good executive and who's more of a legislative type. And just the passion you show talking about summer school, free summer school for kids, and what do you do with the learning gap. Again, the innovation that you're coming up with to help solve these problems and meet the needs of your constituents. I just love seeing that and hearing that from you. So thank you.
Well, thank you.
And then about the meals, are you able to provide meals for families or just for the students? And I just saw where USDA says they're not sure they have the authorization to feed students during the summer.
Oh, wow.
To be a
So we're
change.
doing, wow, we're doing both. So we're feeding the students. And like I said, 62% of them were on free and reduced lunch. We're also feeding their families. So we partnered with the Capital Food Bank, and we went out to solicit private donations. We raised $1.2 million for that fund. The county also set aside an additional $500,000. The churches have jumped in to help us. And you would be just shocked at the need for food. I was out this Saturday helping in a food giveaway that was supposed to start at 10, and the cars were lined up before 7 a.m.
Wow.
So that's what we're seeing. But we're feeding their parents, we're feeding the students, and we're going to make sure that we continue the Washington Redskins. Dan Snyder made a contribution as well. So we're going to make sure we feed people during this crisis. But the need for food, I've never seen anything like it in my life. It made me so upset to watch, the lines growing. And, it's a very humbling experience.
It is, and watching the lines across the country, miles long of people waiting to get food and
Yep.
get in front of the line, there's no food left. It's very disheartening. So we had a question from one of the people on the call about burial assistance.
Okay.
A lot of families don't have, burial can be a costly venture. A lot of families don't have the money to pay for that. And if their loved one dies from COVID, is there any kind of burial assistance that might be available for them?
You know what? That's such a great question. And believe it or not, in all of the questions I've gotten, that's the first time I've gotten that one. And so we do not yet have a fund set up for burial assistance. But you know what? That's something that I'm going to make sure that I follow up with. We have been, we set up here, the state has come to Prince George's to set up, unfortunately, a mortuary because we expected to have such a large number of individuals. But we have not yet offered burial assistance, but you're right, it can be, this is a devastating time. So that's something that I'll make sure I add to my list of things to look into.
How about do you have any good news stories? Any places that surprised you or things that happened that you weren't expecting that showed the level of caring and compassion from Prince Georgians?
Oh, every day. It's every day. When I got out there Saturday, it's one of those moments that you say, you know what? This is why I love the people here. We had so many people come out Saturday. We had far more volunteers even than we could use. And some of these were people who were older, who could have been concerned about their own health and safety. But whenever you call them, they come. And they have shown up over and over again to do whatever they could, whether it was handing out food. We have people who are responding to go to seniors' homes to try to see about them. We've gotten some calls from seniors who have been in distress, and people want to go drop items off for them. So the spirit of the people who are here has really come alive in a really amazing way. And so when you say the good news, oh yeah, we're now putting together a campaign to take those signs. You've seen the signs in the front of the seniors' homes, seniors in high school, class of 2020. So we have about 8,000 graduates, and people are volunteering now to go get those signs into our seniors' front yards. And so, this is when you see the best of people. I have definitely found that this is when you really can see the nature of people, and they are giving, very, very giving. So the stories, this is a sad time in many ways, but it's also, as far as I can tell, a time where we get this great opportunity in this too. Time to recover together, to bind together and focus on what's important. I have never seen so many people, even in my own neighborhood. Sometimes I'm taking walks in the evening. The kids are outside with the sidewalk chalk. I see people sitting in their driveways because they couldn't go out to maybe barbecue in the driveway, just their families. So families, I think, have reconnected in ways that we had long taken for granted. And so that is the good news. The good news is that we've found each other again in ways that we had not. And that when this is over, I think we're going to hold tight to those things that we came to value. But family dinner will never be the same again, right? We're going to enjoy when we can gather together as big families again. At some point, we'll never take that for granted again. So there definitely is a lot of good that will come from this particular crisis.
Yeah, you're absolutely right about that. I think our daily culture is changing through this in terms of we value how we connect, what we do with other people, and to appreciate time that we have with each other. I think it's a lot of good is going to come out of this, with a lot of death and sickness as well. But I think
Yeah. But it's a time of restoration and resetting. I keep thinking we're resetting our priorities. We are resetting and we're going to restore together. And some of that came with some challenge, and some of it came with some devastation. But on the other side of this, even in the government, we're looking at how we can better operate as a government. As I was saying, all of this driving around I've been doing, I cannot believe I get so much work done here. And we're looking for those same efficiencies inside government. How do we operate smarter? Some of the folks who are teleworking, we believe will keep on telework because we're finding that it's just more efficient. We're looking for ways that we can use technology different. Where are we making investments? We're even looking at our real estate in the county and saying, some of the real estate that we were intending to make investments in, now we're finding that we have to rethink really the way that we're going to operate as a government. But that's an opportunity for us that we don't want to miss, is the ways that we can really maximize efficiencies. So there's some good for sure that's going to come out of this.
So there's a great majority of county employees teleworking now. Are they working from home?
Yes, yep, they're mostly teleworking. We do have some essential workers who are out and about, but most of our workforce is teleworking at this point.
We also had a question about what we can do to help you all. Any ways Leadership Greater Washington can help you in your efforts to get through this crisis, to help make Prince George's better than ever? Any thoughts on this?
Well, you know what? So there will be, I hope, a whole lot of thought leadership that comes out of this. And believe it or not, I've already leaned on a lot of leadership, my friends from Leadership Greater Washington. Diana Leon Brown is actually one of my classmates who works in our administration. Rosie Allen Herring from the United Way has reached out to offer her help and to help us with the food assistance. So there are so many areas where we could use help and assistance like that. And I would like to make an appeal to all of my friends and colleagues in Leadership Greater Washington. There are so many of these spaces where we really do need partnerships. As I mentioned, the achievement gap is one that I am, really concerned about. But there are a good number of people from Leadership Greater Washington who are nonprofits in other areas where they don't have the presence in Prince George's now, but we would desire those relationships and partnerships as we seek to deal with some of the challenges that will come out of this. It's not just education, but we're concerned that we may have a homeless problem that comes as a result of this. So I'm going to rely on the thought leadership of a lot of my colleagues in Leadership Greater Washington and invite you. If you are not already connecting with Prince George's, we know a lot happens outside of here, but we want to grow, especially that nonprofit sector, to help us better serve our residents. And, I really do invite, the collaboration and ask people to please, to partner with us.
There's another question about using your high school students to mentor the middle school students and help tutor them, obviously when we can all get together. Is there any thought given to that? And
that's a really great idea. And you know what, I'm going to take a note of that as well. And again, what happens to the child whose algebra instruction was interrupted? What happens to the child whose biology instruction was interrupted? And so I think we now have learned how to connect with technology to do the distance learning. So some of that tutoring, you're right, can be something that we can look to, but we're going to do some of that online. But having high school students connect with a middle school student during the summer, and maybe there's a way that we can offer some kind of credit for that, or offer some sort of credit toward their community service, because we had to cancel our jobs program this summer. They waited to tell me that. I love this jobs program. And they said, we have something really, really sad to tell you. You're not going to like it, but your summer youth enrichment program, we're not going to be able to do it this summer. It's not safe to do it. So we had nearly 7,000 young people in the summer youth enrichment program. We canceled camps. Can you imagine these campers who we've never canceled camp? So we now have to find constructive ways to engage our students whose parents will likely also be going back to work soon, but that's an excellent idea, the tutoring.
So Lupe Quinteros-Grady is the one who asked that question. And she Lupe corrected me saying you can do it virtually, which is what you recommend, Madam Executive. So you beat me to the punch. You understood the question better than I did. So thank you. Then we had another question about youth involved in the criminal justice system, about disconnected youth. And now that we're seeing sort of people in school, students being disconnected, what about those who've been in trouble before, and what are we doing to look out for them during these times?
That's a really great question. So Employ Prince George's is a unit that workforce development arm for Prince George's County. And we are redoubling our efforts in Employ Prince George's. And we'll be looking out for those opportunities. We were just meeting, for example, last week with a company called 2U, a technology company that would like to help us to build up the workforce development space, invite in some of our young people, help them to build some of their skills, and help connect them with employers. They have a they have a high success rate of being able to connect some of our disconnected youth with some of these employment opportunities after they have trained them. And so we're going to redouble our efforts to make sure we don't leave anybody behind when this is done.
I'm just reading one last question here. Somebody suggesting that we've got some experts within LGW to help you with the achievement gap and do some other things in terms of tutoring mentoring students. That came from Bernard Wright. So.
Oh, Bernard. Yeah. Hi, Bernard. Yeah, I have a lot of friends in leadership Greater Washington, and I have to tell you, this was the best thing ever. It was. Not only have I met, and I'm not just saying this because I'm on this screen, not only have I met some people who have become great friends, Charlotte Reed, and I mean, I've met just tremendous lifelong friends in leadership Greater Washington, but you know, Russ Snyder, people who are also doing amazing things in the nonprofit space who've been reaching out and giving me their help and support. So this is, this is of the decisions, this has been a really wonderful relationship.
Well, two of the people you mentioned, Major Riddick and Monica Goldson, are also LGW members. So we're very proud of them as well. So.
And then I rely on them. Yep.
So do you have any final words for us?
Well, you know what? I want to thank you, first of all, Doug, for your leadership. And, you know, you're the friend who said to you, do you miss being in public service? We sure miss you, you know, but you're still helping in so many ways. And so I just thank you for your, you know, for your continued leadership and for the ways that you continue to serve. And then for the organization that has played such a vital role in the region and helping leaders like me to be successful in these spaces where we, you know, we try our level best, but you know what, we rely on each other. So the expertise, the support has been, you know, critical because we all have at the end of the day the same objective. We care about people and we want to do our best for people. And so I just want to thank everybody, those who took the time to tune in today and to say we're going to need each other even more than ever when this is done. I think this is what COVID has taught us, how interconnected we are. Because COVID is indiscriminate. It doesn't care anything about how much money you make. It doesn't care anything about your race or your religion. COVID has impacted all of us in the exact same way, and it just continues to prove how much we need each other. So thank you for having me here. And I hope that those who are hearing who may be able to partner with us in Prince George's would consider it to help us rebuild and restore our community as we restore the region.
So Madam Executive, thank you very much for the kind words. Thank you for being part of this discussion. We've got a lot of shout outs to you during the whole conversation in the chat box about thanking you for your leadership and everything that you are doing for us. So I've been a big fan of yours for quite some time. You're doing a great job. I just wish you the best, and anything we can do to help, let us know.
Thank you so much, everybody. Take care. Be well.
You too. Thank you very much.
Thank you. Take care. Bye-bye.